homemaker is an important person, whether man or lady, and that's because they influence everything. Children, their eating habits. If we determine the eating habits of children and the family and the rest of the family right initially, it actually grows into the healthy eating even further on into young adult and adult life. So that's set right from the dining table, should we say. What we pack for our children when they go to school determines exactly what they think of food and what they think of eating. What we make them do as form of exercise, whether sitting on the TV and playing computer games, or whether we determine that they go out to play. Of course, these days we don't fit into that, but I'm just talking in general as life goes. Whether we decide that they actually pick up games, if it's a tennis, if it's something which is very active, if it's cricket, we determine how their mindset goes as they grow into adulthood. We determine how to lead a healthy life right at home as we sit around either in our TV rooms or in our dining rooms or in our sitting rooms. That is how we influence lives of everyone. And then when they grow up, they influence lives of others. So I think a homemaker is the one who, right from the day the tiffin is packed for school, determines the influences how the healthy living is actually going to be. Now, getting to that, you said, yes, women. And I think women there's been an increase, not just in young adults, but in women. If I was to tell you that heart disease is the commonest cause of death in women, 6 times more than breast cancer, and maybe 10 times more than 14 times more than ovarian cancer. You'd be so surprised because all our focus seems to be on breast cancer and so on and so forth. And yet women seem to think, and I think it's been from the past that we've actually emphasized women because are less prone to have heart disease than men, that it's sort of been misunderstood that women don't suffer from heart disease. But actually they do, and there's been an increase in the last 15 years in heart disease amongst women. Now that's also happened due to multiple reasons. Firstly and foremost, at least in our own country, women tend to neglect themselves a lot more and take care of the family in a much bigger way than anywhere in the West. Often at times, the lady of the house would be far more interested that my child has this problem. I think I have to get him seen. My husband's developed this. I think I've got to get him seen, far more than saying, I have this problem and I think I've got to get myself seen. That falls always at the back. And I think that's a very, very important message I want to carry out. Every member of the family is important. The lady perhaps is the most important member of the family and needs to take full care of her own self also. The second aspect is that women are more difficult to diagnose in terms of heart disease. There have been books written about this, numerous papers written about it. Symptoms in women are very different to those of men of heart disease. So quite often they are not understood or mistaken for other things rather than heart disease. The tests themselves are more difficult to interpret in women. And certainly women have smaller arteries and the treatment options also. So in fact, across the world, you'll be surprised, there are many studies which are done in which only 1/4 of the patients or 20% of the patients are ladies and 80% are men. And it's not because they don't have heart disease, it's just because they're not coming forward with their heart diseases as such. Furthermore, I think there's always, of course, the situation of stress is always there. We still emphasize that beyond menopause, women start getting the same risk, the risk factors start being exactly the same. The incidence of heart disease becomes exactly the same as men. The risk factors become the same. And women actually have to take care of themselves in the same manner to prevent heart disease. It's so important now that we want to emphasize that exactly the same principles of prevention, exactly the same principles of investigation that we apply to the male population have to be applied to women and ladies to make sure that they don't develop heart disease. It is the biggest cause in the ladies also.
So you mentioned the symptoms presented by women when it comes to their heart health are different. So what are they?
Okay, so while most of them, or while I'd say in a proportion of them, it'll still be the chest discomfort on exercise and walking, etc. Many could just experience symptoms as breathlessness. Many could just experience symptoms of right arm pain, indigestion, all these gas feeling. All these atypical symptoms happen more common in ladies than actually happen in men. And so, not to be misunderstood that any lady who feels that she's getting gas has got a heart disease, but it does mean that investigations should be done and that they should not be ignoring themselves, believing that there are no heart problems or I can't get a heart problem. As I told you, that it's ladies as they get older and it's more towards menopause that their risk factor profile or the risk of developing heart disease matches that of men. But even before that is the situation of, do they have risk factors at all? A strong family history is a very important factor both in men and ladies. If your father or mother or even a first degree relative or brothers or sisters have had heart attack at an early age, and by an early age we mean less than 60 in men, less than 50 in men, less than 60 in women, it becomes a very important factor for the development of heart disease. And therefore, it is very imperative that all such people who have it at an early age in their life, in their families, should get themselves also checked for development of heart disease. The second aspect is the raised cholesterol, the risk factors that we talk about. Ladies who have diabetes, ladies who've got raised cholesterols, hypertension, all of them do need to get checked up much earlier in life. And when I mean much earlier, I mean adulthood. I'm talking about, in ladies, we say that even if there were no risk factors, their tests should be started by the age of 40 onwards. For example, a diabetic lady who's also had a family history of heart disease, with a father having had heart attack at the age of 50. Clearly, at the age of 35 and 40, such a patient should be actually having lipid profile done, having a LPA protocol done, her triglycerides measured, her hemoglobin A1C measured with sugars ruled out, her thyroid function test done, and also a CT scan done of her coronary arteries to know whether this person is falling in the same genetic pool as a father with a 30% block at this time, which would actually create a heart attack 10 years later. And we can take all the efforts of lifestyle modification, cholesterol control, regular exercise and health to prevent that 30% from becoming 70 and 80% 10 and 15 years down the road. A very important question. And there are two aspects to this question. Firstly, whether heart patients get more COVID disease, can catch corona more easily. And second aspect is, what happens if they catch corona? So it's not yet clear whether heart patients are at a greater risk of getting infected from corona, and probably not. They carry the same amount of risk as far as every science tells us at the moment of developing COVID, which means that all the precautions that we say for every individual remains exactly the same. Masking yourself, and by the way, as you saw, I had mask on when I arrived. It's only because there's nobody in this room that I've got a mask on, and so that's the only reason you haven't got a mask on. But we know that mask and wearing mask properly up to the nose, mouth covered, even during conversation, is the most important aspect. And the same for heart patients versus no heart patients. The same amount of sanitation, hand washing, hand hygiene as for everyone else, and the same social distancing and staying away, or physical distancing, not social distancing, and staying away. And that is why it is not that the heart patients have to be any less or any more. But what is clearly been demonstrated is when heart patient will get a COVID, they can get more severe form of the disease and can actually have a greater risk of death. And that is important to be understood. So it is not the chances of catching corona, but if you catch corona, you've got a worse corona and the higher chances of dying from it. That is worrying. And that is why the precautions have to be so immense. And that there are various reasons around that, which I don't think I should pour any of the the listeners with it related to ACE2 inhibitors and related to the fact that how it gets into the heart. But the way corona affects heart, also in heart patients, is the factor that once it can also affect the heart directly. So those who get pneumonias from corona, and we call that lung inflammation, and rather it's not pneumonia, it's a lung inflammation response, can also get a heart inflammatory response. And the sicker the patient gets, the more the heart gets affected, even though heart can get affected even without the lung being bad. And that's other interesting phenomena, that the presentation of corona in heart patients can be a result of clotting, clot in the brain causing a stroke, clot in the heart arteries causing a heart attack. And yet the corona is only discovered, there's no lung inflammation or very mild lung inflammation seen. And it's only discovered subsequently on testing. So corona can affect the heart by directly causing clotting of the blood, resulting in heart attacks, can cause inflammation inside the heart arteries, thereby resulting in blockages inside the heart, suddenly rupturing and causing the heart attack. Coronavirus can actually infect the heart muscles, both directly or as an inflammation, causing a decrease in pumping efficiency of the heart, leading to a heart gradually going down in its pumping efficiency, leading to heart failure, and even a cardiogenic shock, as we call it, a shock-like situation where the blood pressure becomes very difficult to maintain and a patient needs to be put on a mechanical circulatory support system to maintain him. The virus can also cause inflammation of the conduction system of the heart, thereby resulting in very fast heart rates, dangerous type of fast heart rates. It can result even in very slow heart rates, what we call extremely slow heart blocks, which thereby result in needing a pacemaker to keep a person going. So there are various mechanisms. And by the way, these mechanisms, as they present, can affect 20% of corona patients, the sicker variety of corona. But heart muscle damage to a mild extent has been seen in 75% of the patients who've recovered from corona, even though they have not manifested themselves as heart patients during the time of their admission to corona. But once you do an MRI, you start seeing inflammatory process. We still don't know that inflammation, which has still not manifested itself as breathlessness, as any form, what will be its effect 6 months later or a year later? Would it cause a permanent scarring, which would appear as breathlessness 6 months later or a year later? We don't know. This has been seen in the lungs, as you know, that people who got some effect on the lungs and inflammation seen, which is common, have actually got that permanent for 3 months. It actually hasn't disappeared for 3 months and 4 months. And some may actually end up with some permanent damage to their lungs in process of time. So it is a worrying thing that there's a lot we don't know about this virus and the way it's causing damage to us and how much of that damage is recoverable. But the good part is, and that's for your listeners, is that most of the people have anyway, 85 to 90% of the people have a mild disease from which there is a complete recovery. And those are not the ones who are going to suffer the long-term consequences at all. They will recover mostly completely. It is the ones with more serious inflammation and infection, the ones which goes down to the lung and heart, that we actually are worried about them, not just at the time of discharge, but for subsequent months as well, till we understand more about this disease process. There's so much of advancements in science which is happening, and so much more understanding about this. For example, treatment options, though not yet proven, are soon going to be there because numerous trials on 100, last count was 500 different trials being done on various forms of agents. So we're going to have definitive answers to the treatment options as well, definitely over the next couple of months. We're going to definitely have a vaccine for this over the next 6 months, is my belief. The world has got united to say that we have to beat this disease process, and we will find how to beat it because it's the common interest of the world to do it. So I think we cannot be dejected once we have the whole world with a single aim. Then we're going to beat this disease process. We're going to find a way to come back. We're going to find a way to return to what we call normality. And that's why I don't want to call this new normal. I want to call this the new abnormal, because let's not forget what the normal is. Let's not forget that the normal means sitting with each other, having a cup of coffee. Let's not forget the normal means taking our children out somewhere to a nice holiday spot and actually being free of every concerns and jumping in the swimming pool without wondering who's around us. That's what a normal is. Let's not forget that a normal means taking our children or our spouse out to a quiet place up in the hills to actually have fun. That's what a normal is about. Let's not forget that normal is going to a library, a cinema hall, into a mall. And let's not forget, normal is when we sit with all our friends and all our relatives and have a party. And normal is when we go to work and are able to hug our colleague or able to shake hands with a friend. That's normal.